What's the difference between osteoporosis and osteopenia? This is a crucial question that many people don't know the answer to, but it can make all the difference for your bone health. If you've heard of these conditions, you should know that both affect your bones, but in different ways. Osteopenia, simply put, is the first sign that something isn't quite right with your bone density. At this stage, the loss of bone mass is moderate. Your bones are still relatively strong, but they're starting to lose the mineral density needed to ensure their strength. Think of your bones as a bridge. Osteopenia is the gradual weakening of the pillars supporting that bridge, and if not taken care of in time, it could lead to something more serious. According to a study published in the Journal of Clinical Endocrinology and Metabolism, osteopenia affects over 33 million Americans between the ages of 50 and 60, and more than 80% of these cases are women. The main factor is the decrease in hormones like estrogen in women and testosterone in men, which naturally occurs with aging. This reduces the production of bone tissue, leading to a loss of bone density over time. If osteopenia is the warning sign, osteoporosis is the fire. When someone reaches the stage of osteoporosis, their bones are extremely weakened and porous. Now, imagine that same bridge with deep cracks. Any extra weight or pressure could cause it to collapse. Osteoporosis is the stage where the risk of fractures skyrockets. According to the National Osteoporosis Foundation, more than 10 million Americans suffer from diagnosed osteoporosis, and this number is rising as the population ages. Hip, spine, and wrist fractures are the most common and can be devastating, especially for the elderly. Osteoporosis is known as a silent disease because it often shows no symptoms until a fracture occurs. An interesting fact published in the Journal of Bone and Mineral Research revealed that 1 in 2 women and 1 in 4 men over the age of 50 will experience a bone fracture due to osteoporosis at some point in their lives. This shows just how dangerous the disease can be, directly affecting quality of life. Now that you understand the basic differences between osteopenia and osteoporosis, how do you know which condition you have? The diagnosis is relatively simple. A test called a bone density scan can measure the mineral density of your bones. It's used to determine if you have healthy bones, osteopenia, or osteoporosis. The result is given as a T-score. If your T-score is between -1 and -2.5, you have osteopenia. If it's below -2.5, you're in the osteoporosis stage. This test is particularly recommended for postmenopausal women and men over the age of 70, as noted by the International Osteoporosis Foundation. Several factors increase your chances of developing osteopenia or osteoporosis. Let's highlight the main ones. Age. As we age, bone loss accelerates. Family history. If your parents or grandparents had fractures or osteoporosis, your chances significantly increase. Hormones. Women in menopause lose estrogen quickly, which contributes to bone weakening. A diet low in calcium and vitamin D. Calcium is essential for strong bones, and vitamin D helps your body absorb it. Lack of physical activity. Being sedentary is one of the biggest culprits. Weight-bearing exercises like walking, light jogging, and strength training are excellent for strengthening bones. Prolonged use of corticosteroids. These medications can weaken bones over time. According to research published in the New England Journal of Medicine, people who do resistance exercises, like weightlifting or yoga, can maintain bone density longer, significantly reducing the risk of fractures. The good news is that you can take steps to prevent osteopenia from progressing into osteoporosis. Along with following a diet rich in calcium and vitamin D, such as dairy products, spinach, and fatty fish like salmon and tuna, staying active is essential. A sedentary lifestyle accelerates bone loss. Therefore, regular physical activities like walking, dancing, or even strength training could be the key to keeping your bones strong and healthy. The Bone Density Solution, your answer to strengthening your bones. This is where the powerful program, the Bone Density Solution, comes in. If you're concerned about your bone health and want a natural and effective approach to improving your bone density, this program could be the solution you've been looking for. It combines dietary changes, specific exercises, and the use of natural supplements to improve bone health. And the best part, it comes with a money-back guarantee, meaning you have nothing to lose. To learn more, click the pinned link below this video. If you enjoyed this video and want to keep learning how to protect and strengthen your bones, subscribe to our channel. We have plenty of other interesting videos waiting for you. Don't forget to leave a comment below about what you'd like to see in future videos. Let's continue this journey together toward a healthier, more energetic life.